Hello, my name is Dr. Kourosh. I'm a podiatrist, and today we're going to talk about toenail fungus. Toenail fungus can present itself with a wide range of sign of symptom. The sign of symptom could include thickness of the nail, discoloration of the nail. The nail could be crumbly and brittle. Also, most of the time it could be also associated with pain. As the fungus progresses, it causes the nail to become thickened. Thickened nail can press against the foreskin on the toe and could cause pain. Now, George here presented with discoloration of nail and thickening of his nail. He also complained that there is substance underneath the nail. He also complained of redness on the skin, and he also complains that he has a lot of itching. To get rid of the fungus, you basically have three options. Option number one would be oral medication. Oral medication possesses problems. One of the first problems is the duration of the medication, roughly about 3 to 4 months. Second problem with the pills is that they do metabolize through the liver. So we actually need to do a blood test to make sure the liver is okay before you take the pill. Also in the middle, we have to repeat the blood test to make sure your liver is not being damaged by the pill. Third problem, there's no consumption of alcohol. Fourth problem, you might have some side effect. But the last problem with the pill is that the fungus has developed a lot of resistance during the past few years towards the pill. That's option number one. Second option involves surgical excision. With the surgery, we're basically removing the nail as a whole, hoping that we also excise and clear up the fungal nail. Problem with the surgery is that it's not enough just to take out the nail. You also have to still take the medication. The last option that we have, which is a fairly new option, is a laser. The way this laser works is, first, when you come in, we take a few pictures just to document what we're starting with. The second thing is we're basically going to decrease the fungal load on the nails. After we've done that, we're going to start a laser process. Now, the laser that we're using today is called Pinpoint. This is the only laser that was designed for treatment of toenail fungus. It's also the laser with the most clinical data behind it, and is also one of the few lasers that is cleared by the FDA for treatment of toenail fungus. After you decided to treat your toenail fungus using a laser, it's important that you do your due diligence and look for the doctor with the most qualification to perform your procedure. It's also important for you to ask questions of what laser they're using to treat your toenail fungus. The way we're going to do this is we're going to do several passes on the nail, but we have to create some kind of grit on the nail. So we start by going horizontally across the nail, only moving millimeter by millimeter, and every time you hear that beep, the laser is being fired. Most patients don't feel any kind of sensation at all. After we're done with the treatment, there's no immediate gratification. We're not physically removing any fungus out of the nail. What happens is, after we did the laser, the fungus is not dead. As your nail grows, it starts pushing out the old nail, and you're going to see more clearing and more clearing at the base of the nail. Generally, it takes 6 to 9 months for the whole nail to replenish itself before you see all the improvements. Now, over the past 2 years, we have done approximately 900 cases of treating toenail fungus using a laser. Our success is generally about 80% using the laser for the treatment of toenail fungus. We can't guarantee that we can get rid of the fungus on your toenail, but we can certainly try, and we will try our best. Now, if the laser treatments is something that you would be interested, please give us a call, and we'll be glad to assist you.